Cool. So over to you guys. I'll just jump through to that first slide. Here we go.
Yeah, so hi, I'll start it off. My name's Ashley. I'm currently a third year student doing Bachelor of Pharmacy at the University of Otago.
Hello, hello, everyone, and kia ora. My name is Josephine, and I am a third year pharmacy student as well. And I'm currently in the University of Otago as well.
Sweet. Now, if you are keen on becoming a pharmacist, you have to study the course called Bachelor of Pharmacy or BPharm for short. Now, it's a 4-year degree. It can either be studied here in Dunedin, where we are right now, or up in Auckland. Now, compared to doctors, us pharmacists have a more regular shift and an easier work-life balance. So generally a 9 to 5 in weekdays. Some pharmacists, actually, a lot of pharmacists do open on Saturdays, but we'd like to keep a day off to ourselves as well. And with a pharmacy degree, you can work with patients at hospitals, help out communities at local pharmacies or retailers such as Chemist Warehouse, and behind the scenes of making medicines. So, as a pharmacist, your role is to become an expert in medications and these medicines. So, starting off with the University of Auckland. Now, when you're studying BPharm in Auckland, the entry is either Bachelor of Health Sciences or Bachelor of Sciences. Now, it is quite different to Otago, which will be explained later. Another thing as well, if you're going through BPharm, your selection is based on your grades for your first year, and a short interview is what we call MMI. So, MMI is just an interview that the will assess you, like not it's non-academic. So they will assess you and ask you questions about qualities and capabilities that you have, um, about who you are. So examples would be like your communication skills, the way you react to certain challenges or situations, how you can show empathy to your patients, and just an overall your outlook, your contribution positively towards your patients and how you can ensure their safety. Another thing as well, when you're studying pharmacy, you learn about patient care, teamwork, clinical skills in health and society. You get hands-on experience in hospitals, pharmacies, and other health settings through your lectures, your workshops, and most of all your placements. Those are really, really cool and something you can look forward to when you're studying pharmacy. And another thing as well, when you're on your last year, you have an option to do an honors. Now, honors is basically where you can do research. So if you have like interest in research, this is a very good opportunity as well, or advancing your clinical practice. And yes, this is based in Auckland, which is one of the biggest cities here in Aotearoa.
Okay, so I'll be talking about the University of Otago. So for the University of Otago, it's kind of similar to Auckland. So you must complete a health science first year to apply for Bachelor of Pharmacy. So you usually take about 7 subjects in your first health science first year, and then just see whether you get into pharmacy and other healthcare professionals. So there's a strong focus on science, pharmacy skills, leadership, and healthcare management. So it is a hands-on clinical placement, especially in the fourth year. So for your second year, you do have to complete a placement in a community pharmacy. And for this year, in third year, you have to do community pharmacy, 1 week at a community pharmacy in a rural area, and then a hospital placement in other regions. So I was able to do mine in Dunedin Hospital. So there is an option for a honors year. So this is where if you're interested in doing research, that's definitely something you can look at. And this is based in Dunedin. It is vibrant, student-friendly city. It is really small community vibe as well. So basically everyone just has a lot of mutual friends and you can make friends easily here as well because it is really small. Yeah. So what is involved? This is a 4-year degree. So for your first year, so health science and science papers, in Auckland, and also in Otago before applying for pharmacy. So you have to complete that first year in order to, get into bachelor's of pharmacy. For the second year, you will learn the science of medicines and intro to patient care. So it can be different for both unis, but for our uni, we do a bit of chemistry for the first semester and then more clinical in semester 2 and then just yeah, you learn about more about diseases, how to treat those diseases as well. For third year, this is really heavy on clinical work. So you learn about different diseases, how to manage them. And you do have short placements like hospital placements where you're placed in a hospital and also a community pharmacy placement where you're placed in like pharmacies. For fourth year, so this is a bit heavy on placement. So you do 1 month placement in first semester and second semester where you rotate from hospital, community pharmacies. Some people do go into clinics as well. And it's just really hands-on for fourth year. And it does include leadership and professional practice as well. Yeah. So you're muted, Ashley.
Oopsie, sorry, it didn't work. Apologies. So moving on. So after you have completed all that 4-year course in pharmacy, you then go and register yourself for the Pharmacy Council of New Zealand. Now, once you've registered, sorry, before you do that, you get to do this 12 months of training supervised with a pharmacy. It can either be in a hospital or a community pharmacy. It's up to you, and it's your choice as well. And in this registration, you have to go through an exam as well. It's composed of 12, I believe, multiple choice questions, and some of them can be calculations. So, yeah, it is very kind of heavy with calculations, this exam. And then once you've done all that 12 months training, internship year, you then gain your full registration here in New Zealand, and now you can work independently as a licensed pharmacist, and you can start your career in your desired field, whether it be, again, like I've mentioned, community, hospital, industry, or even your research roles using your honors degree. Now, why did I choose pharmacy? It's a very good question. I actually reflected a lot on this question. So, yeah, this is what my answer was. It has always been my dream to be in the health workforce and to be able to confidently prescribe the right medication to patients. I've always had a passion for like different medicines and how they work in our bodies. So, yeah, I saw the opportunity with pharmacy and yeah, I grabbed that. Yeah. Combine this with the passion I have to help with people to be on their best and healthiest lives. I found being a pharmacist was the best degree for this one and a future career choice I have made. And I also made friends along the way too, such as Josephine right here.
So why did I choose pharmacy? So I have a lot of reasons and we can talk a long time, but I just put my top 1, 2, 3, 4, 5 reasons. So my first reason, obviously, helping others. I've always wanted a career where I can make a difference. And because I'm a person that wants to give back and want to contribute into people's health and well-being. Also, I do enjoy patient interaction. If you're a person that really loves to talk to patients, contribute to their care, and just recommend things to make them feel better, then this is a really good degree for you. So yeah, so I work at a pharmacy at the moment, and most of the people that come in, I'm still a student, but they really trust you and your recommendation. They will come in, asking for recommendations like, oh, I have a flu. What should I take for this? They really do trust you. Even if you're a student, their trust is like they really trust you and they always take whatever you tell them. So that's really good. Career diversity. So there are many pathways you can do with this degree. You can work in a community pharmacy, which is where I work right now. So I really do enjoy a lot of patient interaction, talking to patient, measuring their blood pressure, and just asking about how their day is going and so forth. You can work in a hospital. You can do research, public health, or you can also do regulatory work like MedSafe. So MedSafe is a government agency that regulates medicines, medical devices, and related products to ensure that they're safe. So I got the opportunity to do a internship there this November. So really excited things opportunities for growth. You can open your own pharmacy, you can work overseas, you can be a locum pharmacist. So, a locum pharmacist is a pharmacist that can travel in order to work. So, you don't have to work in one place. You can also go into cosmetics and pharmaceutical industry, which I love, and internships and experiences as well. So this degree does offer great placements in order for you to gain that hands-on experience, and you do get internship opportunities to work in mental health institution or MedSafe, like those government agencies, and gain hands-on experience, and yeah, and explore different areas of pharmacy. Oh, and my last one will be my white coat. You get this cute white coat. So if you get into pharmacy, you can invite your family and friends, and yeah, you go up and you get your cute little white coat, something to be proud of if you go in. Yeah. So that's all from me, guys.
All right, so what we're going to do now is we're moving on to the pre-submitted questions. So thank you so much for sharing a little bit about your journey so far in pharmacy. It's been super insightful. And now we're just going to get you guys to answer these. And then after this, we'll open the floor to some live questions. So whoever wants to take away the first question, go for it.
I can take the first question. So, what areas can you specialize in within pharmacy? So, you can specialize in a lot of areas. So, in the hospital, you can specialize in pediatrics, where you specialize like in children's care. You can also do ICU, intensive care unit. You can also specialize in cancer, which is oncology. Like, you can pretty much specialize in a lot of like areas. You can also do cosmetics if that is something you're interested in, especially the girls, or like you can go into industry. So yeah, it is a really diverse career, and there's so much, like so much you can specialize in. Yeah. Unless you have something to add, Ashley, onto that one as well.
No, really, I'm pretty sure you've covered all of those that you can specialize in with pharmacy. Oopsie. So next question, how can I best prepare for my first year of study? Um, First year coming to uni was really, really daunting. It was really different to high school, and it was really big. And yeah, you tend to get lost, but there are a lot of people who can like support you in this, especially in university. Um, to best prepare, I guess, for first year of study. I don't know if it was mentioned before to you guys what subjects you need to take, but the best ones are like the top three sciences, like your chemistry, biology, and physics. You can either do some of the maths and statistics, and also a bit of like English literacy as well. Can either be English or geography or history. Yeah, those subjects are your first ones that you prepare yourself for university. And another thing as well, just communicate with some school liaisons or someone you know of who have studied in university, as it is really, really different, like jumping from high school to university. And yeah, attending to these certain webinars. There are plenty around. Yeah, I think those are really, really great to prepare yourself for first year studies. Anything you like to add, Josie?
Oh, you pretty much covered everything. So I'll just so what study tips help you get through? So for study tips, like it really depends on the person. You have to do what works for you. But what works for me is printing them out, or just like pictures, if that makes sense. So my tips would be just do flashcards if you can, active recalling if you are interested in. And if you are going to stay in a college or a hall, I really, really, really recommend that you take advantage of those tutorials that they offer. There are also other free tutorials that the university offers. So just take advantage of those tutorials and just ask questions, and just do what works for you. You don't have to follow other people's way of studying. Just do what works for you and you'll be fine. And time management, guys. Manage your time wisely and have a good balance between studies and also enjoying the things that you love to do.
Yeah, I think I can add something to that as well with a study tip. So yeah, like Josie said that You don't have to follow your friends' like study methods unless it does work for you. Another thing with studying is that it's really important to ensure that your health is at its best because you can't be studying with lack of sleep or not eating well. So yeah, that's just one important thing to remember as well when you're studying. Ensure that you're healthy and you're eating well, you're sleeping well, and yeah. So moving on to the next question, is pharmacy more hands-on or theory-based? Now, I think it's a bit of a mix on both, but it's definitely more on hands-on because you actually do all those things, especially in your skills labs, where you get tested on your skills on how to become a pharmacist. So when you're dispensing medicines, you get to count, or you get to make your own medications, is what we call compounding. So like making creams, making lotions, and all that. We also get to make lip balms, which is really interesting. I did not know that until I got into pharmacy. So yeah, the thing with theory base is that, especially for those going through, say, honors or doing research, there's still a lot to learn about medications and how they work on us. And there's different um algorithms that we follow through when we are giving medications. And a lot of them, it's just based on how these medications work in your body. So yeah, I think that's where the theory-based part is coming from. So it's a bit of both, but more on hands-on. Yeah.
Yeah, and before I go to the next question, to add on to what Ashley said, so for theory-based, like it is hands-on, so you will learn a lot because it makes more sense when you get into the job. Like it just clicks and like theory stuff just makes sense when so you don't have to worry about it. It does come with practice. So to answer, so what skills should I start building now to stand out later in my career? Okay, so one of the advices I got from a pharmacist who is working in a hospital would be if you can find a job in a pharmacy, that I would highly recommend that because even if you're like serving customers, that is a really good skill to have as well in pharmacy, just to gain that confidence in speaking with patients and just yeah, customer service and just yeah, having that confidence, also problem solving. So you have to think quickly and also attention to detail. So in our degree and in our career, we have to pay attention to little details because the wrong dose can harm patients. So just ensure patient safety. Yeah. So just excellent communication, customer service, teamwork. You have to know how to work in a teamwork because you're going to work with other healthcare professionals like doctors, physiotherapists, and dentists, and so forth. Yeah. So I would really recommend if you are interested in pharmacy, just find a job, or if you can get a job in a pharmacy, that would be great. But if not, that's okay. We have skills labs where you can learn that when you get in pharmacy. So yeah, anything that works for you.
Yeah. To add on to like what Josie said as well, um, when you're in the pharmacy, one thing I liked about being in pharmacy and studying pharmacy is that you actually get an opportunity to work in a pharmacy while you're studying. So from that, you can also get skills, your communication skills, or even just being as a pharmacist. You learn your way through in your course and also in your job that you potentially will get as you're studying through your placements. Yeah, so next question. How can I tell if pharmacy is the right health career for me? Whew. Well, this question, I'll tell you a little bit about my story. So first year, I pharmacy wasn't really my first choice. My first choice was either med lab sci or medicine. And I learned that um, pharmacy was all about chemistry and all that. And I got intimidated from that because chemistry wasn't really my greatest either. And yeah, I did not get into any of those medicine or med lab sci. And so I took a different path, which is biomedical sciences, where I then learned about pharmacology and stuff. Pharmacology is about the study of different medications and how you can make them, and like the people that work in like drug companies, that's what that course is about. And then yeah, like I've said before, that I've had the passion to also want to help people, and I put two and two together, drugs, patients, then yeah, pharmacy. So again, if that is your passion to learn about medications, how they work in your bodies, how they work in your patients' bodies to get them better, to get them feel safe in your community, then I believe pharmacy will be the right career for you. And also if you want like a good work-life balance.
Sweet. So, is it really a lot of study? I'm not gonna lie, it is a lot, but nothing you cannot handle. You can handle it. So, the reason why there's a lot to study for this one for pharmacy is because we are dealing with patients and people's lives. So, it's really important that we know everything, okay? So, if we give too much, overdose. If we give less, it won't work, and people will just not get better. So, yes, is the answer to that.
Yeah, so the last question, main differences between working in a rural versus urban pharmacy. The main difference would be that in rural, because there are not a lot of healthcare services present. So as a pharmacist in a rural pharmacy, you're kind of like um not really forced, but like somewhat you're supposed to do a lot of things compared to like an urban pharmacy. So rural pharmacies would tend to put the most that they can in a pharmacy. So not only do you get to dispense, not only do you get to work in retail, but they will more push on other things such as prescribing. In that pathway, like they will push you to prescribe because there's not a lot of health services that are out there present to, prescribe medications for you. Whereas urban pharmacy, um, yes, you can prescribe, but however, a lot of those who would want to prescribe would either want to go in a hospital setting or in a more clinical pharmacy setting. Not a lot of those who wants to prescribe would want to be in an urban pharmacy, if that makes sense. And yeah, with urban pharmacy as well, I believe there's just more like communication with a lot of healthcare professionals because there are more healthcare services, so you tend to communicate more and not worry about the distance, not worry about the barriers that rural pharmacies have, such as like, yeah, the cost as well of traveling to and delivering all those medications to your patients. And yeah, that's something that we do want to work on, the equity between rural and urban. So yeah.
Did you have anything to add for that, Josie?
So for the last one, I do want to add. So when I did my rural placement, it was compared to urban pharmacy, it is a bit, it's not as busy because there is less people there. But in urban pharmacy, it's really busy. You have to like, you always like busy and like you have to recommend, you have to go out, speak to patients. But in rural, there were times where we just did not have anything because there's barely any people there. And the staff is like small as well in numbers because there's not that many people there. But definitely take a career in rural, guys. It is really rewarding and you will talk to a lot of patients. And in rural, you get to see more other things, like other cases. How do I say this? Like other cases that you barely see in urban. Yeah. So a lot of emergencies because people are so far from town, and we have to think of ways to help the patient. So definitely a good place to work. Rural is good if you want more training. Yeah, that's all from me.
All right, so what we're going to do now is open the floor to some live questions. So thank you so much for answering those pre-submitted ones. That was submitted through the registration from people who are on this webinar at the moment. So there are some questions that are popping up in the chat already. So please just pop them in the chat, don't be shy, but we've already got one. So you guys can sort of maybe answer this kind of both of you. But someone's saying, do you guys have a favorite pharmaceutical drug based on its function?
Okay, I'll start on this one this time. Do I have a favorite drug? Not really. But if there's one interesting drug that I'm pretty much keen on is ibuprofen. It's so common, however, there are so many contraindications on that medication. So I kind of want to, delve into that one more and I guess learn more about it because yeah, as common as it is, you can see it in like groceries and like yes, in the pharmacy as well. It is very much contraindicated in a lot of conditions. Yeah. And can we work to develop new drugs? Definitely. Like I've said, if you want to do all those advanced learning, go for your honors. You can work at, I believe, some pharmaceutical drug companies take you in. I think does MedSafe, Josie, sorry. Does MedSafe get you to do those trainings or?
I think for my internship, they did mention that we are going to look at those as well.
Hmm.
We have to look at like formulations and
Yeah.
just a lot, whether they're safe to like, yeah, just safety and yeah, a lot. I wish I did the internship, but I'll let you guys know after,
Yeah.
yeah. But definitely making drugs and seeing if they're safe.
So with the extra study, I wouldn't say extra if you are going to your honors because honors is already part of your fourth year. But if you do want to say like, make your own drug that's not from like kind of like a similar copy to another drug, then definitely you would need extra study for that, like do more research about it. Yeah,
Yeah.
that's really interesting, huh?
Yeah, you can. And there's also another degree where you that you can take as well, which is pharmaceutical science.
Yeah.
So they're more on that as well, if you're interested. So my favorite pharmaceutical drug would be paracetamol. It helps me so much because it is the safest drug to give to pretty much everyone. Like it's so safe. Like if others like ibuprofen is not safe for some patients, paracetamol is the best way to go. And yeah, if you do want to do like develop new drugs, pharmaceutical science is another one as well, but you can still do it in a with a degree in pharmacy. Hmm.
Cool. So we'll just move on to that next one, but keep asking them in the chat, guys. So someone said, what would you have liked to know before you started your pharmacy degree, and what made you choose Otago over other unis for pharmacy, so such as Auckland, I assume?
I'll go first. So the reason why I chose Otago because it is the top, like when it comes to medical studies. So I chose Otago because of that. What would you have liked to know before starting pharmacy? It's not that serious. Just enjoy. Whatever you do, enjoy. Don't be, yeah, just enjoy it. Enjoy what you learn. Yeah, and think positive.
Yeah, so to add on to that question, what would I have liked to know before starting pharmacy? The story about me knowing that pharmacy is all about chemistry, that is false. It is chemistry. However, it's only like one semester. The rest is all about physiology and anatomy, like learning about how your body digests all these different medications is not just about chemistry. So I would have liked to know that, then I would have applied that in my first year. Next question, why I chose Otago. It was a really, really intense debate, but it all fell into less city, less to walk around, I guess. And yeah, less complicated to get to. And yeah, I've learned that with Otago as well. There's beautiful nature walks that you could do compared to like Auckland. There's definitely more scenic. I wouldn't say more scenic, but some scenic places that are easy to get to. And if you do need a break, you can get to those places. Shout out St. Clair.
Awesome. Did you have something to add as well, Josie?
Oh no, I was gonna answer the next question.
Go for it, please, go for it.
So which papers in pharmacy are the most interesting or useful? Every paper is useful, but if I were to pick my favorite area, it would be oncology and urology. I really enjoy those papers. So it's about cancer and like the treatments for cancer, how cancer develops and so forth. Yeah, but that's my favorite. But every paper is useful.
Yeah, Jersey's right. Every paper is useful. Um, for me, I guess the most interesting one was cardio. It's just the most, like, I guess for me, it's the most common one that you can treat to right away and you can lessen the burden of it. Yeah, so all the papers in pharmacy is really, really useful. So the way our papers work, it's not like any other um course, I'd say. So generally courses are like 4 papers each semester, whereas with pharmacy, it's more like integrated. So they're all in one big paper and your exams are based on that one big paper. So it's really, really good, like in terms of like studying, because you're only studying in like the same particular topic for that one semester. So yeah, it's not like the 4 different papers. You have to worry about like, oh my gosh, I need to study this subject. Oh my God, this other subject. It's all integrated, which is really, really good. And it's all about, yeah, like I said, how the drug works in your body and the little chemistries and also ethics and law about drugs. Yeah.
Oh, thank you for that. So there's no more questions in the chat for the meantime. So what we're going to do is just ask some questions that were asked at last year's pharmacy webinar, just because I think it will be helpful since they were asked last year to just sort of ask them again with a new set of students. So someone asked last year, what's the hardest part about studying pharmacy? I guess in your personal opinions.
Memorizing, memorizing all the different drugs and all the different diseases, and just like because some drugs, if you have so many complications, like you have heart problems and you have cancer, we have to think of like the safest medication to give a patient because we cannot give the same medicines to a patient because we have to look at everything, how their liver is doing, how their kidney is doing, just so much. We have to look at the patient as a whole, like, and also we have to think about their families, their support. Just so much. Yeah, it's just so much, but I enjoy it.
Yeah, to add on to that as well, yeah, there is a lot to study in pharmacy. Um, yeah, like I said, if it gets too much, there's always support, especially here in Otago. We have very amazing tutors that help us, student support that help us if you do find it really difficult or challenging throughout your year. So yeah.
Cool. So I'll just ask this one. It comes up in sort of all the webinars as well, is how competitive is it to get into this degree? Is it sort of only a certain amount of places? Is it kind of you get rejected? What's sort of the story around that?
Um, I'm not quite sure how it is in Auckland because they do have the MMI, the interview. But for Otago, I'd say it's first year is always competitive. But to get into pharmacy, I think it's not as competitive just because not a lot of students would want to go to pharmacy. They always want to go for med or dent here in Otago specifically. So yeah, it was not as challenging as the other courses. But yeah, there is less, I think they take in less students though compared to other courses, which could be challenging for some. Um, but yeah, in general, it wasn't for me at least. But first year was tough.
Yeah. what Ashley said, but I did have a friend. She found it competitive to get into pharmacy. She got rejected as well. So there is limited spots to get into pharmacy, just to it's good to be aware of that. But yeah, it's not as competitive, but still, yeah, it is pretty much limited.
Yeah, I'm assuming that's sort of the case for most health degrees, that they all are pretty competitive no matter what you're going for. But the general understanding is that med is always the most ruthless in terms of the amount of seats for everyone. And we found out last night that optometry is also pretty ruthless too. Yeah, so I'll just ask another one. Oh, there's actually one in the chat, sorry. So someone's saying, do you have more group work or solo assessments in third year specifically?
So much, not that much, but good assessments that you would enjoy, and also a lot of group work. So you get assigned with different students, and I found it really fun. Like it's really good to work with other students as well. Yeah, that's for me. I loved all of our assessments for this year, but yeah, not that much for this year, but a lot last year. I think more next year.
Yeah, to add on to Josie as well, yeah, there are more, I think, group work than solo assessments, especially for this year, because you're working towards your fourth year, which is doing your placements, doing all these activities for your learning, and majority of them is how you interact with certain people. So yeah, they're just for third year at least, they're trying to train you to learn how to be to have a good teamwork, to have good communication, especially towards other healthcare professionals. That's what we're targeting for this year.
All right, so I think we'll sort of break this one up. There's three questions here. So start with which papers are the most science heavy?
I think science is in health or like.
I think just like sciences in general. So are there certain papers where there's quite a lot of like chemistry and other sorts of things, or are there papers that sort of don't have any science at all?
Oh, I think it's just for our first semester and second year. That's pretty much it. And then the rest is just, yeah, just the first semester. It's really chemistry,
Mm,
but now it's just biology and a few of chemistry, but not much.
nice.
No physics, guys. No physics. So that's a very, yeah. If
Yeah.
you're not into physics, pharmacy definitely, yeah, is for you.
Yeah, I think that's kind of a common question because I know that physics isn't always the most popular. It's quite difficult. Yeah, so we'll move on to the next one. So which papers are more communication or counseling based?
Um, so yeah, so like we mentioned before on our second year, our first semester ever as a pharmacy student, it's all about chemistry. Um, but after that, the rest of the semesters are communication based. So, like I've mentioned before, we do these integrated papers. So each integrated papers, you have certain conditions to learn about, certain drugs for those conditions to learn about, and for those, you have to learn to communicate and counsel patients on those medications. And until, um, yeah, we get tested for it every single year, is what we call OSCE. And I think for next year, we only get tested once at the end of the year, which is very, very interesting and can be challenging because you get tested for all of the conditions that you've learned from first year to, from second year, sorry, second year to your last year. So yeah, each paper has communication except for that one that was chemistry based on your first semester. I hope that helped. And for the lecturers, use case studies or simulations. Ooh, case studies, yes, definitely. We do a lot of case studies, especially in maybe not a lot in the lectures, but definitely during workshops, that's when we get to integrate what we've learned through our lectures and talk about how we can work on these certain patient cases. And for simulations, I wouldn't say simulations because um we get tested like pharmacy skills during labs. And yeah, I wouldn't say simulations. Yeah. I think that sorry. I'll get back to you on that one, but Josie, if you want to take over.
Oh no, you pretty much covered everything, Ashley. Yeah, but to add on to those communication and counseling, you do have a chance to practice every week with your peers and also with tutors in those skills lab that we mentioned before. So yeah, you get a lot of practice before the main exam.
I'll ask a question that was from last year because it actually ties very well into the questions that were just asked. So it's kind of weighing up how important are communication skills versus science skills and science knowledge. Is it sort of a mix of both, pretty much, or would you say communication skills are more important?
I think both are important, but for me, it would be communication skills. Well, I think it's like 50-50, so it's really important to have the knowledge and also the confidence to communicate that knowledge with your patients. So yeah, so it's an equal one, but the more you do it, the more you learn. So you'll be fine with more practice, you'll perfect it. So both are important.
Cool. So I'll just ask another question. This is just something that's kind of playing on my mind because it's been asked in the past, for other degrees as well. Would you say that like already being quite like good at science is important to get into this degree, or can you sort of maybe you're not the best at science, like you're getting achieved your merit in your science papers, and then you get into pharmacy. Do you get better kind of instantly, or, if that makes sense?
Um, I'd say well, for me, when I was in year 13, um, I it was during COVID. So I did get some E's, but a good majority of them were like A's and M's. So I'm standing here as a pharmacy student. So yeah, as long as you have that like base understanding of like these sciences or say for example chemistry, because that's the one that is very heavy on your first semester in pharmacy. So just an understanding about those acid bases, I think. And if you do find that really challenging, there's always like support throughout university as well. So say you did pass, you got into university, you got into your first year, there are so many tutorials, so many other tutors as well that are outside your course that's just like from university themselves that could help you as well. So yeah, yeah, even if you did not do as well in high school and you still got into university, yeah, there's a lot of tutorials and tutors that would help you along the way and yeah, boost that knowledge of yours. And also YouTube. There's a lot of YouTube tutorials that helped me through my first year.
And guys, I am a living proof. I wasn't the best at science, but I'm doing pharmacy and I am learning a lot. I am learning a lot in pharmacy, so I wasn't really good at some areas in chemistry, but when I got into pharmacy, I learned more and more, and now yeah, I would recommend doing YouTube. It's good to have a good background, but also, guys, you're learning, like you're here to learn, and you don't have to be perfect at everything. It does come with practice, so don't worry about it. There's nothing you cannot do. You can do everything. So just as long as you aim for the stars, guys, you'll be fine. Don't worry.
Exactly. Sweet. So we've actually just hit our time now for the 45-minute webinar. So I'm just going to close it out, but that was some really insightful questions from you guys in the chat. And Josephine and Ashley have done such a fantastic job of presenting pharmacy to us. I'm feeling a little bit inspired to go on and study a pharmacy degree after that, honestly. But if you guys did have any final questions, just flick me an email. You guys all have my email from when I sent out the Zoom link, where you can find my email on Hauora Taiwhenua's website as well. But yeah, thank you so much, guys, and I hope you all enjoy the rest of your evening.
Thank you, Emily. Thank you, everyone.
Thank you,
Thank you.
everyone. Come to pharmacy.
See you guys.
See ya.